Hello, my name is Francis, and I'll be discussing an NPR article about Mr. Sovereign Valentine, a 50-year-old man in Montana who was diagnosed with kidney failure and was told that he needed outpatient dialysis. He was referred to an out-of-network dialysis center 70 miles away from his home. After Mr. Valentine finished 14 weeks of dialysis, he got his bill. It was approximately $500,000. Fresenius had charged him approximately $13,000 a session. After Mr. Valentine's case was featured by NPR, CBS This Morning, and Kaiser Health News, Fresenius waived the $500,000 bill, and Mr. Valentine was only responsible for a $5,000 deductible. A Fresenius spokesperson stated that Mr. Valentine should have been billed as an in-network patient. His insurance was a subsidiary of Cigna, and Cigna has a contract with Fresenius. The primary bioethical dilemma in this case is access to healthcare. The high cost of healthcare creates a barrier for many patients who need life-saving treatments or medications but cannot afford it. Many patients either have to pick and choose or totally forego all treatments and medications. The principle of justice, and more specifically, distributive justice, is at stake in this issue. Distributive justice is the idea that there should be a fair distribution of resources such as healthcare. In the Code of Ethics for Nurses, Provision 9 details social justice. Nurses should be patient advocates and fight for access to treatments and medications. Understanding healthcare costs is of fundamental importance to the nursing profession. If patients cannot purchase their medications or afford to pay for treatments such as dialysis, it is a direct threat to their health. As healthcare advocates, nurses need to be cognizant of a patient's insurance coverage and financial obligations. Considering costs in this holistic approach to treatment improves healthcare outcomes for patients because a treatment plan is useless if a patient cannot follow it. Furthermore, this article on rising healthcare costs highlights the importance of providing adequate primary and preventative care. Many costly medications and treatments can be prevented if patients receive regular checkups and education on how to prevent or control conditions such as diabetes, hypertension, and obesity. By treating these conditions at early stages, healthcare costs can be lowered. Thank you.